Hope you're all able to hear me.
Yeah. Can I hear me, sir?
Good. So I want to introduce first of all, this course to all of you. So this is a wonderful course. We're going to have an introduction session today. Today we're open it to the public so that people can get to know what the course looks like. Because otherwise, if you don't know what a mango tastes like, if you haven't tasted mango in your life, you wouldn't know what a mango would taste like. So you should not have a small piece of mango to taste. So that is the idea of this, because people don't know what first of all, modern, they don't know there is an area in dentistry field in ancient things. So people don't believe, they generally think something they will give for medicine or something, some paste or something like that. So there is a huge dimension of ancient science involved in Shalya Tantra to all kind of tantras dimensions, even advanced surgery is there. In Ayurvedic, EY Patel University has an entire PhD program for that. So we have all this knowledge, but only when we are doing it in a modern way, because knowledge need to be upgraded. We cannot keep in the old way of teaching. So today this course is designed in such a way, we have a wonderful a modern doctor who is open to ancient ideas. Difficult for people to get a modern doctor open to ancient idea, which is the main thing that need to happen these days. So because if you don't have that component, it's going to fail. The ancient doctors alone cannot develop this science. So we need modern doctors, and that's the way we need to have both work together. And I mean, this is one of our plan in the future for government. It was a proposal to the government to do this way. Here it is really happening here, where already they have integrated. So we have two doctors here. So Dr. Vaibhavi Joshipura and Dr. Su Kumar. So I will give a brief introduction about Dr. Vaibhavi, and she will introduce Dr. Su Kumar in this field. So Dr. Vaibhavi is a consulting periodontist and founder, CEO of Intident Healthcare Private Limited, a platform to integrate health sciences and technology into mainstream dental practice. She was the Dean of Sri Rajiv Gandhi College of Dental Sciences and Hospital, Bangalore from 2013 to 2016, and Chief Operating Officer, Institute of Ayurveda and Integrated Medicine, having completed an MDS in periodontology from Government Dental College and Hospital, Ahmedabad, Gujarat in 1995. She began her academic career in Bangalore and went on to become a professor, postgraduate guide, and head of the department 1966 to 2017, 16 in various dental colleges. She also practices as consultant in private clinical and hospitals in Bangalore. An avid researcher, she submitted her doctoral thesis on relationship between untreated periodontal disease and adverse pregnancy outcomes to Gujarat University in May 2017. She was member of Institutional Ethics Committee of various dental colleges and also Institute of Ayurveda and Integrative Medicine, Bangalore. She has been a reviewer and an editorial board of a number of peer-reviewed journals in the field of periodontology, and chair sessions and present papers in national, international dental conferences. Research papers have been published in peer-reviewed journals. For the past 2 to 3 years, she has been practicing now it's many years, probably 5 to 6 years, practicing integrative dentistry, and provides a platform to dentists and patients for video consultation with Ayurvedic dental specialists through Indent Healthcare. She also promotes research in this area. So this is a vast thing. If you look at how the profile goes, she's completely into that. This is the area that we're looking for. It's a missing area. Very few people that I know who go into this dimension of Ayurveda. And I suggest a request Dr. Vaibhavi to take over and also introduce Dr. Su Kumar, so that both of you are on the same page. So give me a second. Yes.
So namaskar all of you. Good morning. I feel very joyful and also privileged that I'll be able to get associated with all of you for a period of 12 weeks, and together with Dr. Su Kumar, we will take you through the journey of how to handle oral conditions with integrative dentistry or integrative approach. So as Dr. Shan said, let me introduce Dr. Su Kumar. So Dr. Su Kumar is a Shalakya Tantra specialist. This is a particular postgraduate branch in Ayurveda course of medicine, where they get MS degree, masters in surgery, because Shalakya Tantra is also a surgical branch, and they handle ophthalmology, ENT, and dentistry in a very different way than how we do, but they do. So I have been, both of us have been working together for more than 3 years now on integrative dentistry, and all my patients of periodontal disease, to simplify it, the gum diseases, are handled by Dr. Su Kumar. So he advises me also on so many matters about how to integrate the dental care. And together we have recently started a project on pre-malignant oral conditions. That means the precancerous conditions happening in the mouth due to tobacco chewing, cigarette smoking, and things like that. And he has been extremely helpful and a very humble and an expert in this particular area. There's very few Shalakya doctors have a lot of exposure to oral conditions and dental conditions. Dr. Su Kumar is one of them, and I'm very happy to be associated with him for the last 3 to 4 years. So with that, Dr. Su Kumar, would you like to tell us something?
Sir, you have to unmute. Yeah.
Yeah. Good morning, everyone. Yeah. So I thank to Mr. Shyam and Dr. Vaibhavi for allowing me to speak for a few minutes. So let me introduce myself. Like as Dr. Vaibhavi has told few things about myself. So I am a post-graduation, means I did masters in Ayurvedic ophthalmology, ENT and dentistry. So since this course or this orientation is regarding dentistry, integrative dentistry, so we have been associated since more than 3 years in the field of dentistry with Dr. Vaibhavi. So we are mainly dealing with many of the oral conditions, starting with periodontal disease or some mouth ulcer or precancerous lesion. So Dr. Vaibhavi used to do all the dental procedures, and I used to take care of diet and lifestyle modification and some of the medicinal management. So I'd like to say that we found very promising result with the integration with the two systems. So we thought, why can't we share this knowledge or share this experience, and also to educate the people regarding the integration. So Ayurveda is not only a branch of medicine, which also deals with lifestyle management and also to how to make a healthy living. So with this intention or with this aim, so I think this course or integrative dentistry probably helpful to all of you, I believe.
Thank you. So Dr. Shahan, should I start the
Yeah, you
presentation?
can give a little bit of introduction, so that what you're going to cover in this course, and a little bit of introduction to the both of you can give, like what does it really means by Ayurvedic dentistry. Is it new, or do we have enough idea, like do our sage scientists, our scientists have enough knowledge in this? Is it
Sure.
modern? Can we detect something? Or is it practical? Have you done real-time cases? All those things you can discuss. So we have
Sure.
you can use like
Sure.
maybe 30 to
Can
40
I
minutes.
would
So yeah, time. Yeah,
I would like to share my screen. Can you please enable it?
yeah. I'll make you a. Uh, okay. Can you check, please?
Yes. Yeah. Can you see the shared
Yes.
Yes.
screen? Okay.
Yeah.
Yes. So before going into the actual integrative dentistry, I would like to talk a little bit more about why we need integration. See, because in India, definitely, I really don't know about the other countries. Ayurveda has been existing for 5,000 years, and we modern dentists are existing for maybe 100 years, 70 years. And we always think that our own healthcare system is enough to take care of the people's problems or oral problems. And each of us sit in our own small cubicle or our own small space, and we think that yes, we can do it, we can handle everything. And it just so happens that after a few years of practice you realize that no, there are limitations. So both of us also will be talking about our limitations of our own health sciences. And that's why we started thinking about integrating. So before we come to integrative dentistry, I would like to talk to you about why integration in medicine or in healthcare overall is required. See, our lifestyles and food have become very complex and different than our grandparents. We eat more of the processed food, ready-made food, easy to eat food, junk food, things like that. And we eat food which is very soft. We don't require the teeth actually. People without teeth also can eat all kinds of food nowadays. Whereas if you compare our grandparents, we used to have lots of food which require a lot of chewing, you know. So not only that, the type of food, and we have stored food, we have frozen food, we have all kinds of food which was not available to our grandparents. So it has become very, very complex. We just don't eat things which are growing as crop and just bring it home and cook and eat, right? It's very, very different. So most of the diseases currently, which has high mortality and morbidity. Okay, so the non-medical or dental audience today, the mortality and morbidity means the uh, death due to diseases, and morbidity is the illness, or the due to diseases. The rates of the morbidity, have become focus more on the chronic conditions or non-communicable diseases. By non-communicable, I mean non-infectious diseases. So last 50, 70 years of area basically had the infections, all kinds of infections, and the inventions of penicillin onwards, all kinds of um, antibacterial, antiviral, anti-protozoal, all kinds of medicines have been invented because basically the diseases all this while last 50, 70 years were infectious. Now, after conquering them, the focus has turned on the chronic conditions or the non-communicable diseases, non-infectious diseases. We also call them lifestyle diseases, or diet and lifestyle conditions. So the chronic diseases and injuries are the leading health problems globally now. Okay, so not the infections. Infections we have been able to more or less handle. So the lifestyle diseases, when we come to dentistry, in addition to socio-environmental determinants, it's highly related to the lifestyle factors, which are in oral conditions also. Most of them are chronic conditions. So we'll go into our course or modules. You must have received the list of the modules. In that we will be covering so much in detail about how these chronic conditions affect the oral cavity. So we have realized, especially me and Dr. Sukumar and some other few Shalakya doctors who are also associated with me, we have realized that focusing only on our own healthcare system is not helping us. Not only us, our patients, because there are lots of things which keep recurring and which doesn't respond to the treatments we give and things like that. We need to integrate. So, and this is so true in integration in medicine as well as integration in dentistry. And I think it's a very smart decision nowadays to integrate both, right? So let me talk to you about how important it is mouth for us. So we always think that the heart is very important and the brain is very important. The kidneys are extremely important and the liver is also important. And I really don't know in this list of important organs, where do we fit the mouth? Okay, so let me tell you only one thing here. If we want our very important or vital organs like heart and the kidneys and the brain and everything healthy, the only way to keep them healthy is to eat properly. And to eat properly and make sure that all the nutrients and nourishments go to our vital organs and the vital organs remain healthy. For all that, our mouth has to be healthy, right? I think this is simple common sense and logic that if our mouth is not healthy, we'll not be able to eat properly, chew properly, digest whatever food is to be digested in the mouth properly. And this in turn will affect the digestion later on. And this is definitely going to affect the health of the vital organs. So this one particular point tells a lot about how important mouth is for us. Now, for that matter, let me ask you this question: how many of your friends and family members have got the dental treatments done, and what are your experiences? So I have summed up, the dental problems are annoying and painful. So they are not worth sacrificing the leave. If you have a heart problem, you will definitely go to the doctor and you'll apply all these leaves and whatever he suggests. But for oral problems, for dental, for tooth, why do we have to sacrifice our leaves? We might as well accumulate those leaves and take a vacation with the family, right? So they are very time consuming, waiting and treatments. You have to wait for hours together in the dental office. And then the treatments also take a lot of time. Scary looking equipment and instrument. The first time, or the day when you have a dental problem, you feel, oh my God, I have to again take an appointment and go to the dentist and wait there. And I don't know what the treatment will be, whether it will be painful, and a lot of anxiety and apprehension. And they are recurring. Okay, every 3 months you have got to go to the dental office and get the cleaning done, and again you have to go, and again you have to. So it's like recurring, it's like never ending, right? And expensive. My God, the premiums we all pay for dental insurances, and the money which we pay for a dental treatment, it's really, really expensive. And now there are additional worries about getting COVID-19 infection from the dental clinic. In India, then the dental practitioners are still not allowed to practice dentistry because of the high rate of transfer of infection from the dentist or the staff or one patient from the other, cross infections. So this is how we perceive dental treatments. I'm sure all of you would agree with me, right? So if that is the case, then looks like we don't seem to be doing anything right, because in spite of doing what we think right about dental care or oral care, we have to undergo all these things again and again and again for all through our life, right? So we think this is enough. Twice brushing, using mouthwash, flossing our teeth, mouth fresheners, fluoride applications, regular cleaning or scaling. If we think that this is enough and with this we will never have to go to a dental clinic or to the dentist office, I'm sure we all know that we are mistaken. And this doesn't look like enough. So if so much of things also not enough, then where do we go? And what do we do? Right? There is a lot of scientific evidence which says that the dental problems are not reducing at all, whether in the developed countries or in developing countries. So let's see why dental health is important, why everybody is talking about dental care and things like that, and why we should also talk about dental care and dental health. So I'm quoting one particular article here. In 2017, this was funded by Bill Gates Foundation, and on 195 countries, the study was done, and they've done the research about the burden of diseases, injuries, and health related conditions. In that, the oral conditions have been particularly mentioned. So the number of people with untreated oral conditions rose from 2.5 billion to 3.5 billion in 2015 throughout the world. Now 3.5 billion people with untreated oral conditions. We are talking about half the population on the planet, which is untreated. So you can imagine how many will be actually affected by the dental problems, right? Because some of them are treated, right? So if more than half the population is suffering from dental conditions, don't you think now is a time to give a little more importance or focus to the mouth, to the oral cavity, to the teeth, and to the other structures of the mouth? In 2010, the oral treatment costs were estimated 298 billion US dollars. Now this is only 2010. We have now crossed another 10 years. So this shows that the oral, once the dental diseases start, treating them is a very, very difficult problem, is very expensive, right? So expensive dental treatments, inaccessibility to dental care, and absence of dental insurance. So in the countries like India and so many other countries, dental insurance is not even there. And in US, as far as I know, so many of the dental treatments, including the gum surgeries, which I do, and so many other like implants and others, are not covered by many levels of insurance. If even if they're covered, you may have to pay a lot of very high premium, a lot of money for that. And so many times, there is the accessibility to dental care is not there. So now I'll put one more a point. The oral diseases restrict activities at school, at work, and home, causing waste or a lot of work hours. And there is a quality of life associated with it. Now, we have never heard that a person died of a cavity in the tooth, right? It is very uncommon. It is very rare. That means the dental problems do not result in death unless there is oral cancer. Other general common dental problems do not cause death, but they cause a lot of psychosomatic problems and the quality of life issues. As I mentioned before, we don't have time to go to the dental office. We keep neglecting, we keep taking antibiotics, or we do all kinds of stuff not to go to the dental office. And it is annoying and it's painful, and there's a lot of sensitivity and all kinds of stuff, and the boils and the abscesses, and so the quality of life gets affected very badly with the untreated dental conditions or the dental problems which keep happening again and again. We had done one QOL study in the rural population, okay, rural population in Tumkur long time back. And we had asked them about losing the front teeth because of any conditions, because of gum disease, because of trauma, injury, accidents, whatever, cavities, whatever. This is a population which doesn't have money to fix new teeth. So by losing this teeth in the mouth, how it had affected the quality of life. You can see the results here. 83% people face criticism because lack of teeth. 72% felt reduction in confidence. 77% felt the quality of life was affected. 67% said that their oral health was not good. And 59% also said that if the person doesn't have teeth, we would not like to marry them. Okay. So you can see, how this dental health or oral health becomes very, very important in quality of life, this thing. So now how do we improve all this? So when we have dental problems, we either go for replacement of lost structures and repair. And this will result in all these two slides, which I discussed before, all these annoying, painful dental visits. The only option available with us is the maintenance. So both in the replacement and repair and in maintenance of health, integration is possible. Integration with Ayurveda is possible. Integration with yoga is possible. Integration with homeopathy is possible. Okay. And in this course, in the 12 weeks, we will discuss different aspects of how to do integration, what are the conditions for which we do integration, and what exactly is integration, how can we do it, right? So the dental diseases, according to you, do they occur because of our food habits and lifestyles not proper, or it occurs because we don't clean our teeth properly, or both, right? And in that case, what do we mean by good lifestyle and food habits? As Dr. Sukumar said right now in his introductory remarks, it's a natural way to healthy life, whether we focus on oral conditions or any other conditions. So through this course, we will be discussing a lot about how food and lifestyle can affect the oral conditions, how that itself will ultimately affect the quality of life of patients or people, and how modifying them will definitely help us prevent the oral diseases. And if we already have oral or dental diseases, it will help us giving a better response or better outcome of the treatment which we get, right? So with that, we are talking about health. Now just see, when we are talking about integration, how the WHO classification of health and the Ayurveda classification of health merge together, integrate together, right? And the way they are integrating, most of our concepts and our protocols and our thinking and our logic also integrate. So many times, both me and Dr. Sukumar think together when we start working together, because both of us think that the patient is in the center, not my way of treating and his way of treating. It's always the patient and what the patient needs. And if the patient needs my treatment first, we decide to do my treatment first. And then if we think that Dr. Sukumar's interventions required more, then that is required more. We will elaborate a lot more in the upcoming modules about in the oral ulcers, what do we do? If there is a cavity, what do we do? If there is root canal treatment, what do we do? If there is implant, what do we do? If there are other conditions, what do we do? And how it will have effects on the general health of the people, right? So now there is one more concept which is going on, One Health, integrative effort of multiple disciplines, and they work collaboratively together. So different aspects of healthcare, not only in humans, but also animals and environment. We all know that the air pollution and the water pollution is going to affect the vegetables and fruits we eat, or if you're a non-vegetarian, the non-veg food we eat. And that food, to give you an example, if the cows are given a lot of antibiotics for mastitis and other infections, that milk contains antibiotics, and when you drink that milk, you have all that antibiotics going inside your body and affect your body adversely. So now there is a time to think about One Health, think about uh, how humans, animals, and environment come together. So I've gone a step further than integration of healthcare system only for mouth, right? But this is just a thought-provoking point which I wanted to share with all of you. That when we are talking about integrative dentistry, how myself and Dr. Sukumar work together, we will have long discussions in through the upcoming modules, where few of them I would be taking and another few Dr. Sukumar will be taking. So from that One Health, now we come to integrative dentistry. You can see all these different conditions. I'm sorry if you are not a dental or medical person, you may find this a little difficult. This images may be disturbing, but I want to say here that people are suffering. because of oral problems. And it's not that the problem is in the heart, it is very important, and the problem is the mouth, not very important. Please do not think that. And Ayurveda can help, and it has been helping my patients for more than 3 years now. And if it can help my patients, it can help all of you, your family members, your friends, and the population at large. And it doesn't matter whether the people are in India or in the US. Integration is integration, and it's a combination of mindset, combination of good attitudes, combination of good concepts of different health sciences. Yeah. So I would like to stop my presentation, with this particular last slide. Dr. Shan, would you like to comment on this, or should we? How do we go about it?
So if anybody has any questions about, like, so you're going to cover in the first, like, you want to pull out that, or you want me to pull out, like, what you're going to cover in the 12 weeks, what's going to happen?
Yes. So we will be talking about, in general, the disease conditions in the oral cavity. Most of you may know only about the cavities and implants and root canals and things like that, but there are so many others. So we will be talking about what are those conditions, and in allopathy, how do we treat, what is currently going on, the latest updates, and our diagnosis, how we diagnose, the latest diagnostic aids for that. And I'm also going to talk about the limitations of my healthcare system, where I find helplessness, where I find frustrated that I'm not able to help my patients. Then we will go to the next phase, where Dr. Su Kumar would talk about the Ayurveda concepts and how oral conditions are looked at from Ayurveda perspective. Uh, how do they diagnose it, and their treatment, their medicines, and their logic of how the concepts of how the treatment is planned and given. And he will also talk about the limitations of his health sciences. And then in the third phase, we will talk about how to integrate them both. So how do we integrate the technology in treating the conditions, allopathy, Ayurveda, with the help of technology. We'll also talk about how or what kind of connections there are with general health and oral health. Okay, so, and we also going to talk about the public health, how we can take this concept to the people at large, at preventive medicine or public health dentistry. How do we apply this logic, which we both have found out by working together. And in all these modules, we will be sharing with you our own experiences, the cases, the preoperative and the postoperative, how I diagnosed, how he diagnosed, and what treatment he followed, and what were the benefits. So we will also share the latest research which is going on in, not in this field of integrative dentistry, but the medication, Ayurveda medications, which are regularly or commonly used by Dr. Su Kumar or any other Shalakya or Ayurveda doctors for that matter. What is the scientific evidence about the toxicity, about the side effects, or how do we handle them, things like that. And the research project currently, what we are doing about the precancerous conditions, what were our observations on this. So all these things is going to go for the 12 weeks with lot of interaction with all of you. And we will make sure that the sessions are more integrative, means we will need a lot of input from your side. And I would be very happy to also add, if you have any particular points or things to add to our regular, the way we have designed the module. So together we grow together, we learn together, and we will also learn a lot from you all, the experiences you have had. And if you we would also have some assignments which you all can start working on, probably somewhere in the middle of the sessions, like 5 or 6 modules. After that, we will share a topic for assignment, and you will have another 6 weeks to work on it. And at the end of this course, you may have to submit the assignments, and we'll have a small test for it. So apart from this, if anything else you would want us to add, we would definitely add. But I think, this particular effort, which Dr. Shan is putting a lot of energy and effort into it, we think that let's all work together and make it a success.
Surya, you have a question? Yes, go ahead.
Yeah, Master. Doctor, thanks for the wonderful session, Doctor. So I have a question. Like, so this every time when we go to a dentist, they always insist on removing the four wisdom teeth, even though there's no cavities, no issues with the teeth. So is that really necessary? Because I always argue with them saying, because I don't have any issue, please, I cannot do it. And they do it here in US and also in India. And also one more question, you say like integrating allopathy with Ayurveda, but I see a lot of conflict, right? In that, because allopathy, they insist on the more use of toothpaste and fluorides and all that. But when you come to Ayurveda, they don't recommend any of those things. So is it even possible to integrate allopathy with Ayurveda, doctor? These are my two
Absolutely.
questions.
I have been integrating. See, I will answer the second question first. I have been integrating Dr. Su Kumar's protocols, Ayurveda protocols, which, he does the consultation with my patients and he comes to his own diagnosis and suggests the treatment. So instead of giving toothpaste, I give what Dr. Su Kumar suggests. That's the whole point. When I feel that my toothpaste is not working, I do not want the patient to use toothpaste. So how will I know the toothpaste is not working? Because in spite of giving all kinds of toothpaste and fluorides and mouthwash, my patients keep developing dental problems. So I feel responsible that is there anything else which can help these patients and they do not develop any more dental problems? That's where I seek help from Dr. Su Kumar, right? And with his medicines or whatever he prescribes, if that works, it's fine with me. Whatever works, ultimately the patient's benefit should be at the center of both our thinking, right? So as I told you in my presentation, we think that the fluoride application is ultimate or twice brushing is fine or this toothpaste because we don't have anything else. See, this is about the limitations. As I told you, I would be covering it in very much detail in my module on limitations of allopathy in dental care, because it has been troubling me. It has been annoying for me for the last 25 years that in many cases I am not able to help the patients, okay, with whatever knowledge I have, whatever scientific discoveries or research is happening in the field of modern science, those are not able to help my patients in many times, right? So is there anything I can do for my patients? Yes. With last 3 years of my experience, I can always go to Dr. Su Kumar. And his medications always work for my patients. So that is the answer for the second question. Once I answer your first question, I would like Dr. Su Kumar also to comment on that. Your first question is the wisdom teeth. I really don't know what kind of wisdom teeth situation you have. There are certain people for whom wisdom teeth are still inside the bone. They don't come out at all. They are not visible outside in the mouth. If you take an X-ray, you can see them. There is one way, one variety. Another pattern, what you see is they are trying to come out. You can see a small point and things like that. But there is no space in the jaw. So it cannot come out properly, like all other teeth have vertically come out. And it keeps trying to come out, force itself to come out. And in that effort of wisdom tooth to come out, it can damage the tooth next to it. That is a second one. The third one is, even if they come out properly, if a part of it is covered by the soft tissue, like a gum or things like that, below the tooth and between the tooth and the gum, the food and everything goes, which the patient may not be able to clean properly. And that results in the dental problems. Now, out of these three problems, the ones which are asymptomatic, like the way you said that there was no problem at all, I don't have any issues, you don't need to get the wisdom teeth removed. But if it is the duty of the doctor to tell you that the wisdom tooth will keep itself forcing out. And if during those periods, if it damages the front tooth, the tooth just next to it, that is a very good tooth which will get damaged. And ultimately, if there is no space in the jaw, that wisdom tooth is never going to come out. So you will lose the good tooth also. If that is the case, if the doctor sees, then they may advise you to remove the teeth. The third one is if between the gum and the partially erupted or not totally erupted wisdom tooth, if the food and everything keeps getting stuck and starts the gum problem there, it can become a very big problem, like a big swelling and things like that. So the doctors most of the time, they tell you to prevent all these problems from happening. That does not necessarily mean that all teeth have to be removed. So you need to ask the right question to your dentist, that under which category is your wisdom tooth coming. I'm sure you must have got my point. Did I answer your question?
Yes, doctor. Yes, thank you so much.
Okay. So Dr. Su Kumar, would you like to add anything to the toothpaste thing?
Unmute, sir. Please unmute.
Yeah.
Yeah. So, as Dr. Vaibhav said, so in Ayurveda, the perception of a disease and we see the person or a patient in a different perspective. Like we don't see like oral condition as a simple restricted to oral, restricted to mouth itself. So we consider that a whole, like whole body from body itself, the lesion in the mouth we see. So most of the procedure, like whether it may be extraction, filling, or whether it's some braces, so all those things will be well managed with a modern technology and modern dentist. So we Ayurvedic people, what we do is we help with some of the herbal or medicinal management so that we can augment the healing process. So, like what Dr. Vaibhav has mentioned, like chlorhexidine mouthwash or simple fluoride paints. So, in most of the patients, we might not have seen very good results, even though patient is using regularly. So, in those conditions, we have intervention with Ayurveda. It may not be a paste with some simple home remedies also, just with a gargling or oil pulling. So, we have seen so many good results. So
Yeah.
by that, we thought to say like integration, like procedure or whatever the extraction, filling will be taken care by modern dentist, and whatever the prevention, like further the decay should not happen, further the recession should not happen, will be taken care by a Ayurveda well.
Yeah. So any more questions?
Yeah, I had a question. This is Sindhu. Ma'am, actually here for kids, right, braces are a big thing. Like it's very common, and then the doctors does recommend us to take like tooth because of it. As like for my daughter, the doctor had recommended 4 teeth, and I said I'm not going to take 4. 2 is okay, but four without any issues. Just for that, I was so sad. Like I said, in our culture, we don't remove teeth like that. So I just wanted to request if that is going to be covered in any of the sessions, like how really the importance of braces.
Yes.
They want to look good, but
Yes. See, I will tell you why. See, in last 25 years of my practice, I've seen that when we see the older people, they seem to have wider and bigger jaws, which very easily accommodate 32 teeth. And those 32 teeth also contain wisdom teeth. But over a period of time, because our food habits, that's exactly what I said in my first slide, that our food is very different from our grandparents' food. We don't chew food. So the chewing food, hard food, gives a lot of exercise. It will develop the jaws and muscles of children. But today's children eat very soft food, biscuits and chocos and cereals and things like that. And I have seen it's not very abrupt. Last 25 years, I've seen that slowly the jaw size of the people have started becoming less and less, smaller. So invariably, they are not able to accommodate 32 teeth. Even if you remove wisdom teeth, 28 teeth properly. So the jaw is small, and the tooth number of teeth, if they don't have proper space, they'll become crooked. So that is why so many children, almost all children in the US, in India, it's not that rampant, but in US, it's like a, routine thing, because their jaws are very small. And we never pay attention to such a small thing that, okay, we are not chewing. See, the nature is amazing. Whatever you don't need, it will not give you. So if you don't need teeth, if you don't chew, or if you eat only softer food, you don't require teeth. So I'm also seeing now in this generation that the wisdom teeth do not develop only. That tooth bud only will not be there in the bone. They will be without the wisdom teeth. So this clearly says that evolutionary scale, the nature has realized that we are not using the teeth, because we have shifted to a very soft food, a very processed or artificial kind of synthesized food, which does not require chewing. And the direct result over a period of 25-30 years is this: your jaw size is small, so the teeth cannot be accommodated. And the second part is the wisdom teeth are not even forming now. So in next generations, you will not have problems of getting the wisdom teeth out, because wisdom teeth will not be there only.
Or can we help it form instead of removing it? This is Hariharan.
So yeah, no, I will be um, putting a few of the things with the orthodontic treatment in the upcoming modules. So how we can do it. So if the jaw size is small, and if the child is not in that growth period stage where you can increase the jaw size by different types of orthodontic treatment, then the only option available to make the teeth align properly to look good is to remove few of the teeth and take only so many teeth which the jaw can accommodate, right? So how and what to do it, that we can definitely discuss in the next upcoming modules.
I have one more question.
Sure.
This Hariharan again.
Yeah.
Gum recession, right? Do we have any treatments for gum recession?
We do have treatment, but we have treatment in allopathy also. We have treatment in Ayurveda also. But it is very important to first find out why there is recession.
Okay.
So there are so many reasons or causes why there can be recession. So if you particularly or any one of your known people have recession, and because of that you're asking question, we can take it one-on-one when I am discussing the recession and also the treatment of recession in my third module. The treatments, allopathy treatments for recession. But I cannot give you a general answer. What can be done? There are multiple treatments, as many number of reasons for recession, that many numbers of treatment for recession in allopathy. And the similar things even Dr. Su Kumar can cover when he is covering Ayurveda, how recession of the gums, because they have an entirely different, whenever there is recession, there is Vata predominance and things like that. Right now you will not be able to understand, but once he talks about Ayurveda concepts and then he talks about recession and how they treat, it will be very easy for all of you to understand why he's suggesting XYZ treatment for recession. Yeah.
Perfect. Thank you.
Yeah.
Appreciate
Well,
it.
I think this course will be more of a, idea for you to get a treatment. This is different. You cannot expect that you get a treatment here, because that's a different story. Your individual is different, your body type is different, you have to identify pulse, etc., everything. And then we are opening also that you can approach the doctors for your own private consultancy, and you can get treatment whether you're going to India or whatever is available. They have to send medicines or anything. Those things we can facilitate. But this course is only a general thing, because everybody is there and we cannot spend more time on one person's thing for an individual to give all the things needed for an individual. Overall, I think it will be covered, and that way we're not spending a lot of time on one person in treatment protocols. So you should keep the private thing separate from, but you can ask questions related. That's the reason we are coming here. That's a different story. but private and this are separate, and we can keep that way.
Yeah, I would
So
like to comment. Thanks, Sean, for organizing this. Especially right in the Western world, what's happening in the name of dental care is it's basically humongously costly here. It's very, very costly. On top of that, even insurance, even if you have insurance, it's not met. They don't cover it. They consider most of the dental treatments as cosmetic, and they don't cover most of it. And one thing we all see after living here is somehow we feel like I am fine, but when I go to a dentist, he finds more problem than I ever saw that I have. He always invents. I'm not accusing them, but that's the experience. You feel okay, but you go there, he finds few other things. He finds this and that, and it is a system. It's a toxic system that we have where patient's health is not a predominant policy. So I believe you guys can make a difference to what
Thank
is
you.
happening
Thank
here.
you.
Thank you.
Yes, I treat a lot of medical tourism, dental tourism patients, because they can get the same treatment done with me here in a very less amount compared to them, and I know because it is not covered in the insurance. So we get the same facility and same expertise here in a much less amount. So dental tourism is a big thing. Also medical tourism, but dental tourism also. What you're saying is correct. And I think in this next 12 modules, we will have a lot of one-on-one kind of interaction. And I'm going to make my modules in such a way that I'll talk only for 45 minutes to 1 hour. And then the next 30 minutes would be for this kind of interaction. Even after this module, after this course, once you go back to your dentist, you will know what he's talking about, what exactly you have a problem, and you yourself may be able to realize that, okay, I can take help from Ayurveda now. So let me go and have a consultation with Su Kumar, because you need to go to your dentist, right? You need to go to a dental clinic and sit on a dental chair if you have a dental problem. But in what way we can reduce those sufferings, and in what way we can prevent the new sufferings from coming? That's where the team of me and Dr. Su Kumar comes into place. Yeah.
yeah, wonderful, wonderful. So before Sindhu can ask the question, so so quickly, so I'm just wanted to tell you like a little thing, because see, I go to dentist basically how I prevent things. For example, we don't, they use the pomus. In pomus, they they're colored and other things. First thing, for kids, tell them don't avoid colors, because pomus is nothing but lava, so which is okay, it's a natural material. So I allow them, and then they tell to rinse with the thing. I tell no, we are not going to rinse with plain water is good, or I'll take my own rinse. So we do that. And the third thing, they give the paste, and I told we don't use this paste. We have tooth powder, we are using, we are happy. So when we were doing this, one of the doctors, he was asking, how can you're maintaining this? So one of the senior doctor, he came up with his white guy here, and his experience, he doesn't have any knowledge in the ancient, but he was reading a major paper was published. 3 group they took. One group they regularly brushed, another group they did not brush at all, third group then and there they brushed. What is the result of tooth decay from these 3 groups? Leading pediatric journal, all the groups equal.
Yes.
What it says is, it doesn't matter. It doesn't.
Yes.
See, that means what we are saying is, the people who were not brushing, the tooth decay. Sorry, it's not equal. The people who haven't, who brushed properly, doesn't mean the tooth decay is connected to brushing. So that's what they found. But I mean, that is nothing to do with the brushing thing. Finally, they found is the food is the matter. The food what they're eating here, dessert, they will eat after food, they will eat dessert. So that's a very bad. In our area, first we'll eat sweet only, right?
Yes.
Then only
Yes.
Ayurvedic way is starting with sweet. Here the ending,
Yes.
and ending, bacteria likes those and accumulate. So I'm just telling, this is the problem here. And
Yes.
we can skip those problems. We'll try to avoid X-rays whenever possible. To that extent, we can do something. But with your knowledge, we can even do a lot living here. Yeah.
No. The Dr. Su Kumar will definitely. He is going to handle the food and everything in his presentations. The 4 modules which he is going to take in detail, and that itself will bring down 60 to 70% of your future dental problems. Then other preventive measures like whatever he will have. In spite of that, for whatever reasons, if you do develop dental issues, then we can definitely, you yourself can definitely think about how to integrate, sitting there, going to your own dentist, how you can take help from Dr. Su Kumar. Reduce the number of times you take antibiotics or painkillers, or use this chemical mouthwash. I can just go on and on how this chemical mouthwash spoil the oral microbiome. And I will also give you the further reading kind of links, which you can go through if you are if you want to know more about those. The oral bacteria, oral microbiome, gut microbiome, and oral microbiome are the big time research right now, because they are linked with all lifestyle diseases, all chronic conditions, including heart problems, cancer, kidney problems, all you name it. Okay, so anyway, so how Ayurveda makes sure that the oral microbiome is restored to the healthy, and how the chemical mouthwashes, which just keep killing all bacteria, how they are harmful for you. That is what we are going to, both are going to cover in our presentations. Yeah.
Wonderful. Okay. Well, I think we are running out of time. We told them because doctor has a appointment at home. So quickly, Sindhu, you want to quickly ask the last one, and we can conclude.
Yeah, Dr. Shan, if someone has a question, I can wait till next time also.
Okay. Okay, no problem. Any urgent question, like very not on a personal thing, but overall, So I would just, before the question, what I wanted to conclude is like from this, it's very important that this course should, because it's a new dimensional course, and you don't think I know this. No, we don't know. That's the fact. We don't know. This is a new dimension. How many people can you bring to this course? Because people don't know. Your neighbor may not be knowing that, their children, what to do if they are eating chocolates and other things, they have to. So at least bring 5 people to this course. Take a responsibility, bring 5 people to this course. Tell them this is an important course. We can reduce, cost and all. We are not worried about the cost and all. This should reach. We can, reduce the cost or whatever, it should work. So, but the more the people, we can make it very cheaper also, this course. But we wanted to run this course successfully so that you yourself become almost like a half doctor. Half doctor is dangerous, but still, you can at least learn something to solve your own problems, right? Yes. So we also have guidance, so you can ask, you can call, all these things, we'll make those arrangements. So that's one thing that I suggest everybody to. If you have any questions on these things also, you can ask if they leave also, about course, details and things like that. Yes. Yeah. Okay. Well, if there is no question, we can wrap up.
Sure.
Okay. Thank you so much.
Thank you.
For a wonderful
Thank you.
time,
I look forward
Dr.
to see you all.
Dr. Su Kumar.
Yeah.
So hopefully, you will get a number of people register for this course, and we can have a wonderful session.
Absolutely.
Okay.
Absolutely. Thank you very much. Yeah.
Thank you so much.
Thank you. Bye.